The people in South Carolina, especially in Columbia, there's just a different nature. It's very personable, and you get a true feeling of care. I've always found fascinating about South Carolina is that, somebody somewhere has something similar to you, and if you can tie all those things together, it just makes it that much easier to build bridges. DHHS is South Carolina State Medicaid agency.
We cover a lot of different services through our coverage policies, and so those services can be delivered face-to-face, which is the traditional method, or they can be delivered via telehealth.
My role as part of the health services policy team is largely centered around rural access initiatives and specifically telemedicine. In the rural areas specifically, access to care is a large issue.
And if you look at South Carolina as a state, it's highly rural, so a lot of those areas are not covered. A lot of those subspecialists, even OBGYNs, are not located in some of the counties of our state. And so if you have other physicians that are there, they're able to remotely link in with some of the subspecialists in the more urban areas of our state, then allows those patients to receive that type of coverage.
They are excited.
We're a member of the South Carolina Telehealth Alliance. We actually sit on the advisory council. So we're working as a team to try to improve the health of South Carolinians through telehealth technology.
The State House directs us to help fund this project, and it comes from our budget directly to MUSC. They in turn use, through the Alliance and the connections and the stakeholders involved, they dole out money for pilot projects, up-and-coming projects, equipment, and the connectivity element as well.
The momentum has picked up, and a lot of that is because of the support of the state legislature through the provisos in terms of offering funding, increased level of funding for telehealth initiatives, which ultimately form the South Carolina Telehealth Alliance. So that was very important in terms of pushing this this work forward for our state and making it a little bit more important for everyone to be on board and be working together to hopefully increase access for all of the citizens of South Carolina, not just Medicaid beneficiaries.
What has really proven successful is bringing everybody together and making sure the communication and collaboration are present. It's taken a lot of sacrifice from the different health systems, providers, hospitals, in order to look past some of the relationships from the past and really come together and collaborate in the true spirit of growth for South Carolina.